All right, Ralph Havens here, physical therapist, and I'm with Dr. Tom Giammatteo, one of my longtime friends and teachers, chiropractor, naturopath, and co-developer of integrative manual therapy. And we have a cool podcast today about autoimmune conditions and maybe even things that are considered genetic, like Ehlers Danlos syndrome. I'm going to ask Dr. Tom about some ideas around integrative manual therapy with maybe some thoughts around it that you haven't considered. So Dr. Tom, thanks for being here. I know you're right in the middle of a whole class situation with people over there in Connecticut.
Yep.
I just want to kind of open up to you this idea like autoimmune conditions, Sjögren's disease. I've seen that where doctors say they don't have that anymore after somebody got a session a week for a period of 9 months, actually, for that person. Another person who came in with a diagnosis of rheumatoid arthritis, and then the endocrinologist months later was like, you don't need me anymore. You don't have this. And so, we can't say we cure things. I don't say that, but there's a way to set the body up that it can actually have a healing effect. And even with conditions that if you Google it, it looks like there's no known cure and nobody knows what's the absolute cause of it. And the best you can do is manage it. But with integrative manual therapy, you have a different way of looking at people with these autoimmune conditions or even genetic conditions. We talked earlier about Ehlers Danlos. So I just want to open it up to you and ask you about these types of conditions and IMT.
Yes. So I'm gonna step back a little bit and just say we're teaching a wonderful class on integrative applied psychosynthesis and body work, and the structural body with integrated manual therapy can manifest in a number of different ways. And sometimes it's the physical muscles that don't work. Sometimes it's the emotions that don't work. Sometimes it's the spirit doesn't work. And this was a 3rd-year level class, and it's getting to say, okay, here's the things that the muscles represent, but they also represent feelings and emotions. And we were getting down to talking to those different tissues and what they represent for feeling and emotion, and the people are standing up and go, "Boy, I'm much lighter, less irritated, less of these pieces." So IMT is the structural medicine of the future, bringing structure into that process. And at 9 o'clock this morning, I had my Dr. Karen. She's an 80-year-old gerontologist. Do you know what gerontology means, Ralph? It means
like the helping of old people.
helping of old people. And she's 80 now, right? And she's very severe injuries. She was referred to one of the students that just got introduced to IMT. And she's old school medicine, and she was fearful of vitamins and supplements. And she's been with me about 3-4 months. And she's so hunched over, they actually did a surgical procedure from the base of her skull all the way down to T7. They took they did laminectomies and a fusion, and she looks like she's a super bent person.
Wow.
And I'm trying to encourage her to change her diet and to stand up taller. And she goes, "No, I'm really fearful of vitamins." So we stepped back from that piece, and coming in, and she's going, "Well, I need Botox every 8 weeks, and it's coming on my 9th week, and I'm feeling pretty good. So I'm going to start to reduce my medications." I go like this again. And she's going to get off of 2 super strong medications, baclofen and gabapentin, and they are they help knock out the pain, but they're also very toxic going in and toxic coming out. And I said, "I'm worried about you because we haven't prepped the body for that type of detox. Where now these poisons are going to get excreted from your body and those pieces." And I asked her how else she's doing. She goes, "Well, I went to the casino to see a concert, and I was really super tired walking back to the parking lot." That's almost like walking 3 football fields, right, from these venues and stuff to do that. And she goes, "Nobody's been able to tell me ever, because I get so short of breath, and I am, I have to stop, I have to sit down." And she's very hunched over. And I said, I have the perfect logical answer for you. I said, Western medicine probably can't answer this question, but I see it structurally. You're so hunched over, your lungs don't have the capacity to breathe. So you're only breathing on half a lung, and you're working your muscles, and you're taking in 50% of oxygen, but your muscles need 110. So they're going to make you stop, and you sit down, you sit up, you take a few breaths, you feel better, and you move forward. That's intermittent. And she goes, that's intermittent claudication. I said, no, that's your posture. And we're trying to reverse that. And, the medicines and won't help you do that. We got to get you strong enough to be able to do that. And so I
Wow.
reversed engineered structure into her ability to see these things. And he goes, well, I want to drink Diet Coke. And she goes, and I pull out my big book on Diet Coke and say, this was published in 1992. And there's 20,000 articles on how toxic Diet Coke is for you. And being a gerontologist, she never really thought, oh, wow, why am I doing this? Why am I doing that? And I finally got my first glimpse to give her some omega-3 oils, because she said she got off the chiropractor's table and she has this big purple welt with transparent skin. And they're saying, there's nothing there. I got to build these walls for you and help those pieces. So that sidebar going into all the autoimmune diseases that you talked about, and even Ehlers Danlos syndrome and all those pieces, I feel IMTs answer those questions, and that's like so simple for us to talk about. We answered those questions in 1999, and we've changed everything from rheumatoid arthritis to Hashimoto's disease to Sjögren's disease. You've done 3 or 4 personally. We've done, I've known of hundreds of those being reversed. But we have to really think of what the structure is, Ralph. And going back to the structural medicine, you ask the doctor if this immune gland is important to the body, and they'll just laugh at you. And it happens to be the thymus gland right over here. And it is the library of all your immune system pieces. What did you get sick with? How are you going to fight your battles? And traditional science says it doesn't do anything after the age of 7. But in our research, we can palpate it being this nice, full, big sponge all the way up to 80s. And when I'm talking to chest thoracic surgeons, let's say somebody got in a car accident, they're 70 and really healthy, and they broke their ribs. When they open up, their thymus is really big. But who goes to the hospital? Everybody that has an autoimmune problem, so it's shriveled up and looks like a prune. So the prejudice of Western medicine to think that the thymus does nothing in the world, and it should be this beautiful, vibrant organ that sits underneath our rib cage here, is one of the things that is leading to autoimmune. And autoimmune is a set of diseases that take on different characteristics depending on how that individual has their problem, right? Even if like you said, if it's genetic, we've worked with Down syndrome and other bunch of pernicious anemia, and we've worked on the biowork, and their cells seem to change back, even though the genes don't say that that's working. So that's
kind of wild, like the Down syndrome piece, changing the structure of that face and giving them more space to the pituitary gland and all those areas that make the hormones. It's amazing how much somebody can recover.
Right. So Ehlers Danlos syndrome is a loose, unstable ligament, and it goes back to 7,000 years ago in Chinese and Ayurvedic medicine, is that kidneys and the adrenals actually strengthen our ligaments. But if we're in overload and stress of our adrenal system, our ligaments get soggy. So there are more and more people having ligament instability, Pott's disease, SIBO, and all these things are ligament instabilities, but we're so under stress that the kidney energy can't feed the ligament system, so the ligament system doesn't support you. So you get out to be sloppy, and then you have pains and aches because you're overwearing your joints.
Yeah, it's amazing. I hope we don't get kicked off of these networks for some of this stuff, but it is in the scientific literature. And there's that recent lawsuit that just got the judge just ruled that fluoride is unsafe, and the EPA has to do something about it, like take it out of the water. And one of the biggest problems is it causes kidney problems.
Yep.
So that was my issue. I had that, I didn't realize it, and then still working on my kidneys a bit.
Right. And we always talk about fluoridated water as one of the most toxic poisons that I learned in the 70s and 80s. But again, the media system and the way that Western medicine presents their articles And even the American Dental Association and the AMA present their information. I always go back to when cigarettes came first out, there were advertisements like 5 out of 10 doctors smoke cigarettes for their health, right?
Yeah.
And then there's DDT, and then there's thalidomide, and then there's all the medications that were thought to be good and how they've injured people over time.
Yeah, and so with the key with integrated immunotherapy and with these conditions that are more prevalent now, but are considered autoimmune and maybe even genetic, like Ehlers Danlos, there's this idea that if you can find what is the body, what's the problem with this person's body? Like, are they hunched over and the house of the thymus gland and the lungs is compromised, or is there just some toxin you have to quit putting in your body, or something useful to put in your body? The key is to find the primary root cause, and integrated immunotherapy has a really cool way to do that. The mapping, that's a whole nother discussion.
Yes, it is.
Yeah, and you've seen, so yeah, you've seen stories. We've both seen stories of things that are supposed to be, you Google them and it's like, well, we don't know the cause. It's idiopathic, these autoimmune conditions, and maybe it's genetic, and or it is genetic, and they don't, but do they know? And yeah, we've seen it where these things, where someone ends up not having these conditions, and it's not like we're saying we heal them, but if you make the house better, the body starts functioning. That's basically the key of integrated immunotherapy, is, I suppose, huh?
It's, yeah, and to optimize the best human potential that there can be. Right?
Yeah.
And not to chase it down in a drug. So if you fail with medicines and they just say keep adding more medications on you, and they can't find like a tumor or a certain process, I would say that we should be the next best shot to helping you figure that out.
I think that's the key. Like, if you want our help to find what's going on, we can offer what we see is it's in the way, and things to do that you can do for yourself. And if you need some more help, we can help you with that. Tom's on the East Coast, West Hartford, Connecticut, and I'm on the West Coast, Bellingham, Washington. So Tom is imtwellnesscenter.com, and I am ralphhavens.com, and you can reach out to us. I put the links everywhere. We put this on Spotify and YouTube and everywhere else, and reach out to us, because if you can find what's going on, what the primary cause is, we've seen people get their health and their life back. So I know we're short on time, Tom. I really wanted to get this out there because it's so important. So thank you.
All right, Ralph, we'll see you in 2 weeks.
Thank you so much. Okay,
Bye.
I'll get this off. Okay, Tom, I'll let's see.
Well, show me around. I know I saw the windows before. Where's your entrance?
Oh yeah, so I guess I'm still on Wi-Fi. I forgot to turn off my Wi-Fi, so I can click this, I think, and still be.
Nope, you just killed me. Ralph?
There's the place. Hi.
Show me again, because you just
And
came
there's
back
actually-
online.
Oh, did it just go
Beyond
away?
Limits Physical Therapy, nice. Yeah,
Yeah. Jen had that sign made coming soon.
good.
So
Perfect.
we're gonna get a whole bunch of stuff. Yeah, we got a good spot. So I will keep working on it and getting us all going out here.
Okay, and do you have bathrooms and stuff, or?
Yeah, there's a bathroom through that little door.
Okay, excellent.
Yeah, cool, huh?
Well, if you want any help, send me some maps, Ralph, and we'll start getting I'll assist you in whatever we can do. Okay.
Thank you, man. Yeah, I've got that 20-hour person starting next week, so that'll be cool.
Okay,
Okay, well, have a good one out there.
bye.
Bye, man.